Hi, my name is Iqra Khaleel. I'm a pharmacist here to talk to you about why pharmacists should be allowed to prescribe birth control across the nation. Currently, there are 17 states that are allowed to prescribe birth control. You can see on this list that our very own Maryland, Washington, D.C., and Virginia are on this list. However, it would be very helpful and beneficial if all 50 states can prescribe birth control. Before we begin, we have a couple of definitions that we want to address. So statewide protocol is when pharmacists can prescribe and dispense contraceptives with protocols that have been decided with their respective state board of pharmacy. A statewide standing order is when state health officials like the Department of Health can issue a standing order to allow pharmacists to dispense and prescribe contraceptives. And then finally, we have a collaborative practice agreement. And this is when pharmacists can prescribe and dispense contraceptives to individual patients while working with a doctor or any healthcare provider that is authorized to write prescriptions. If you look over here, we have a table. This table summarizes by state what they are allowed to do. So we have what authority they have, whether they are a statewide protocol, a standing order protocol, or if they are a collaborative practice agreement protocol, different methods that are allowed to be prescribed, whether it's the pill, the patch, the ring, or the shot, certain age restrictions, and whether certain insurances are allowed to prescribe, or allowed to cover or not. So why pharmacists? Why should pharmacists be allowed to prescribe birth control? Well, to say in few words as possible, we're medication experts. We have 4 years of doctorate training. If you look to the right of the screen here, we have a breakdown of the curriculum from the University of Washington School of Pharmacy, for example. Year 1 and year 2 focuses on didactic training, which pretty much just means that students are in class learning about different body systems and what medications work in each body system. And finally, in year 3 and year 4, students are allowed to apply this knowledge that they learned in their hospital rotations or their community rotations, which would be CVS, Walgreens, or any independent pharmacy. We're well versed in pathophysiology, pharmacokinetics, pharmacodynamics, which is a fancy way of saying that we know how the drug works in the body. We're well aware of the side effects and the dosing that can be present with certain medications as well. So the biggest thing that we are worried about in terms of why pharmacists should be allowed to prescribe birth control is accessibility. We talked to 4 women, well, not we, but there are some pharmacists who spoke to women when it came to contraceptives and why they chose that the pharmacy was easier to obtain a prescription as opposed to their regular prescriber. One woman had mentioned that her HMO assigned a doctor that was impossible to see in terms of making an appointment. Some women talked about how they don't want to miss work for the entire day to make their appointment for the doctor. These are just a few of the reasons why women definitely want to go to a pharmacist instead of their PCP or any other healthcare provider to receive a prescription for birth control. Accessibility is very big. When we looked at the Beyond the Beltway infographic from Power to Decide, one woman specifically focused on how her prescription had run out and she didn't have a doctor to fill it and the pharmacist was there to take care of it. The accessibility is very, very high when it comes to pharmacies. Patients are able to access their pharmacy for their prescriptions, and it's easy to talk to a pharmacist as well when they have questions about their medications. So how does it work? How is it implemented and how should we go about it? So Maryland, when we take a look at Maryland specifically, they have a statewide protocol, as we mentioned earlier, that was set forth by the Maryland State Board of Pharmacy. The protocol contains a screening questionnaire. That questionnaire focuses on specific questions that will determine whether or not this patient is qualified to have contraceptives. There's a heavy emphasis on recording each patient encounter and allowing each patient to have access to that questionnaire. Heavy emphasis on referring the patient to a family planning services or a practitioner. We work side by side with the patient to make sure that picking out which contraceptive works best for them and their lifestyle. So the final thoughts and the solution that we have in place is that birth control should be accessible to everyone across the United States. Pharmacists should be allowed to to prescribe birth control. It's very easy for patients to come into the pharmacy and pick up their prescriptions. Uh, Pharmacists are well versed in prescriptions and medications, and birth control is one of them. So they should be allowed to prescribe birth control. We already see some states over here who have approved protocols in place or standing orders, and it seems to be working very well for them. So it should be easy to implement this in all 50 states, and we should focus heavily on how accessibility is very important here. Thank you.